And I think everybody probably knows someone whose parents have Alzheimer's disease or grandparents. The disease is devastating for the whole family. The disease at first is devastating for the person that realizes that they have it because they realize they're about to lose everything that they've built up in their lives. And then, of course, the family becomes impacted too. You can imagine, there's your mother or father who don't even know who you are anymore. From an economic standpoint, what you have are all these people who are literally draining the Medicaid and Medicare resources in the country through no fault of their own. Not to mention the money that's lost from people being out of the workforce to care for their own loved ones. Right now, the socioeconomic burden is tremendous. And, Alzheimer's disease has been recognized for a long time, almost 100 years. But there really hasn't been a significant push to understand it until the medical technology got to the point where people were living long enough that you really started to see the disease prevalent in the population. And now we're looking at the baby boomer generation coming into the age where they're at the greatest likelihood for developing the disease. And so we're literally on the precipice of an epidemic of dementia. The problem is if you think about it, Alzheimer's disease is almost 50 years behind cancer as far as a national and international effort to try and figure out what causes the disease and how to stop it. And so with this generation coming along, and this is in the next couple of decades, there's really not a lot of time left. Our approach to studying the disease is we use brain samples from people who have died in various stages of the disease. Using our brain samples, we try and go back and peel away the layers and sort of go back in time to those first events before people convert from normal to starting to forget. And what are those initial changes? It's like a little snowball, and it just starts to roll. And then it just gains steam and gets bigger and bigger, and then all of a sudden, boom, you have an avalanche. And the avalanche just wipes away their memory, disconnects them from everything that they love, and it's devastating for everyone involved. And so what we're trying to do is, get back up in there and kind of stop that first little snowball from sliding down the hill. And if we can do that, then we can stop the disease. Of course, without the money to conduct the experiments, you can never get an idea off the ground. And if you can't get the idea off the ground, then you can't get support for it from the NIH or any other, funding agency. So contributions of philanthropy to the scientific process really can't be understated or undervalued. Again, it's a complex disease. It's not going to be an easy road, but what we need is just seed money that can push us to the next level and allow us to conduct these experiments, to develop these innovative ideas. That's where true breakthroughs can happen.